Thank you very much for everyone who has been able to join us. Apologies for the little delay. We have some technological issues now completely resolved. I'm beyond thrilled, honestly, to be able to meet with you all here to talk about HIV Voices for Transformation. This is very much about lived experience, and our speakers today will talk extensively about lived experience and the importance of voices. I want to just share with you some kind of ground rules, which we are all familiar with, but I think it's worth highlighting them again. But first of all, if you can mute yourself during the presentation so our speakers won't be distracted from any background noise. Also, I think because this will be very interactive, it would be great if you can then raise your hand when you want to ask questions after the presentations. It goes without saying that the language we're going to use when we relate to each other is a language that is a language of respect, and it's not an abusive language, both in tone and words that we use. The meeting is, as always, the case when we, as EATG, organize a webinar, is recorded. Keep this in mind. It would be good if we could see you. So if you keep your camera on will be great. So we have a sense of who we are and we can better interact with each other. However, if you don't feel comfortable with leaving the camera on, that's equally fine. Because we were running a bit late and have said already too much, I'm going to move to the agenda for today. So if I can have the next slide, please. So we are going to start with an introduction from Professor Matthew Weait, and then there will be a slightly change in the order of presentations here. So we will have Pank Sethi from Positive East follow then by Weait Baker. And then we will have time for wrapping up and questions from the audience. I think it's a kind of about it. There will be also opportunity for you at the end to give us some feedback on the event. And I've taken already too much of your precious time. So this is for Matthew now.
Great. Is it me now? Hi, everybody. Lovely to see friendly faces that I know on the list and people that I don't know. Really good to see you here for this webinar organised by EATG. My name is Matthew Weait. I'm speaking to you from the Department for Continuing Education in Oxford. I think we were going to have, and I hope you've already done it if it's already been provided for you, an opportunity to say what you're hoping to gain from this event. So there's a Mentimeter survey here. So if you have a mobile device with a camera and you're able to download that QR code or go onto it, we're just trying to get a sense of what you're hoping to gain from this. And I think that towards the end of the session, there'll also be an opportunity for you to reflect on whether your thoughts have changed during the course of the webinar. I think we were planning to leave this on just for a few moments, just so that you've got an opportunity to click on it. But I will wait until I've seen a number of responses coming up, because I think that happens live, and I can see how many people have engaged with it. And this will be shared with you, I think, after the event, and it will certainly be available, I imagine, Nicoletta, on the EATG website, so that people can see how this played out. So we have a number of people who are still responding. I don't know whether this is going to be live Apostolos or whether you're going to, it's 11 seconds left to respond. We've had no responses. 1, power. Good word to have first. Fantastic. Hope. Great. That's it. We got hope and power before the responses went off. But maybe there'll be an opportunity to perhaps go back to that. If it was too fast for you, we can go back and do that towards the end if we have time. As Nicoletta said, this is an opportunity really over the course of the next hour to explore a really important topic with extremely well-informed people. So Pank and Weait are both people who, in their own ways, have engaged with the issue of HIV in prison. And I know we have a number of people on the call who have also got expertise in that area. And I'm sure a number of people who are interested more generally in the issue of health and imprisonment and HIV in prison, and not only the physical and mental health and well-being issues that are raised by living with HIV in a carceral environment, but also the broader questions of stigma that are associated with HIV, which are amplified through incarceration and through imprisonment. So I'm really delighted that this has been organised. It's a subject very close to my heart. It's something that I've been working on for a number of years. Those of you who know me will know that that's been quite a lot of my own research area, but I'm not going to talk very much. I'll talk towards the end a bit about what research and scholarship has to say about this area, but the most important thing is about the voices of the people who have been engaging directly with this topic. So I'm going to hand over first of all to Pank, who will introduce himself and why he's engaged with this, and then we'll follow that up with Weait, who's joining us as well. So I'm going to turn off my audio now and look forward to listening to what they have to say. So over to you, Pank.
Thank you very much, Matthew. Good morning, or good afternoon, sorry, everyone. My name is Pank Sethi. I am the Prevention and Testing Manager for the GMI Partnership based at Positive East in London. This is something that is important to me because of my own experiences as somebody that has lived experience of the criminal justice system, that's been to prison, and as somebody that is living with HIV, and the experiences that I had whilst I was incarcerated will have led me to the place that I am now in terms of what I do for a living, the advocacy, and working within sexual health. An idea was formed where I wanted to create a body of work and give people that were living with HIV and that had that experience of criminal justice a voice, somewhere where they felt safe to tell their own story and do it in their own words. And it was something that was thought about for quite some time before it actually came to fruition. And when it did, it has grown and will continue to grow to include as many voices as possible as we go forward. I do have some slides that I will share with you. Bear with me. Okay, let's get this going. Do let me know if you can see this. Is everybody able to see that?
Yeah.
Great. Okay, so this project addresses critical issues at the intersection of public health, criminal justice, and human rights, focusing on the stigma and discrimination faced by people living with HIV within criminal justice. The initiative also highlights the lack of visibility and voices for HIV-positive individuals through criminal justice and seeks to challenge the misconceptions about HIV transmission and risk in these environments. The issues are explored through an exhibition featuring photographs by a single artist, showcasing the stories of individuals living with HIV who have had interactions within criminal justice. And using photography as that medium, the project aimed to humanize these experiences, raise awareness about the unique challenges faced by this population, and challenge pervasive stereotypes and misconceptions. The exhibition's execution involved a deeply collaborative process between the artist and the subjects. Participants such as Weait, whose story we will hear later today, shared their personal narratives in a safe space and a supportive environment, which were then translating into compelling visual stories. And these photographs serve as a powerful storytelling tool, bridging the gap between lived experience and broader societal understanding. The project exemplifies the potential of visual art to communicate complex social issues, and engage diverse audiences and inspire dialogue about systemic inequities. There were key lessons that did emerge through this. The use of visual art proved to be an effective means of communicating the nuanced realities of living with HIV in the criminal justice system, providing a platform for marginalised voices, underscored the importance of representation in fostering empathy and understanding. And additionally, the project highlighted the role of personal narratives in challenging systemic issues, emphasizing the intersectionality of health, justice, and human rights. Ethical considerations in portraying vulnerable populations were central to this process, ensuring respect and agency for all participants. And it demonstrated the potential of art to influence public perception and catalyze discussion about policy reform. The implications of this project extend beyond the exhibition itself. It underscores the urgent need for more inclusive and compassionate policies within the criminal justice system, particularly those addressing the health rights of HIV-positive individuals. And it highlights the importance of education around HIV in correctional facilities, challenging misconceptions among inmates and staff alike, and points to the value of art-based interventions in addressing social issues and fostering public dialogue. Collaborative approaches such as this one the ones that were employed in this project can amplify marginalized voices and create impactful social commentary. And it's a testament to the transformative power of art in addressing pressing social issues. It bridges the gap between public health, criminal justice, and human rights, using those personal narratives and visual storytelling to challenge stigma, promote awareness, and advocate for systemic reform. And in doing so, it provides a roadmap and a tool that can be used when considering policy and pushing for lasting social change. I'm going to just stop sharing there for a second. I also want to sort of add that too often people in prison are excluded when key decisions are made. Access to healthcare is challenging for them all, even more so for those living with HIV, and threats of violence, discrimination, or when it comes to jobs, for example, when they're incarcerated, and the stigma that still exists. And many times interrupted access to medication means that those living with HIV suffer far more than their counterparts who are negative. There needs to be greater understanding, and this begins at the very top in central governments. There needs to be greater education on national levels that begins with updated campaigns that expels myths and misconceptions. And there has to be support at them, and this begins with prisons acknowledging that they themselves have a part to play in ensuring that custodial and indeed all staff show empathy and that confidentiality is respected. Telling people living with HIV that you respect them and that you don't see their condition is like saying you have to pretend we aren't living with HIV in order to respect us. And it doesn't work like that. Humanize people living with the condition and respect us for enduring through the years of fear and disgust and hatred. Implement change by first accepting those closed systems, such as those found in prisons, that have compounded the problem further, and vocalize loud and clear that if we are to be an inclusive society with equality for all, we must all bear blame before we can champion change. And for change to happen, we have to prepare. And by the way people living with HIV have been treated for the last 40 years, you must believe me when I tell you that we are prepared. And the question is everyone else? Thank you for that. I will pass you over to Wayne, who will tell his story. Wayne is one of the subjects in the exhibition. His story was one that is not unique. It is, we hear many stories like this throughout criminal justice, throughout the prison system. He was kind enough to actually share his journey with me, his story with me. He was kind enough to allow me to portray that with his story and his portrait, and for that I'm eternally grateful. But for now, I'll let Wayne tell you his own story in his own words. So over to you, Wayne.
Firstly, good afternoon to everybody. All it took was moving cells, just a simple transfer. But that was enough. One officer recognized the medication was on, and soon word spread. Prisoner to prisoner, officer to officer. Suddenly, everyone knew. Imagine moving to a new neighborhood. The movers tell your new neighbor something personal. That neighbour tells the person across the street. And before you know it, you're facing accusations. You're intentionally infecting people. This is exactly how it happened to me. Prison staff are trained to assess risk, supposedly educated to understand the realities of health conditions. When I first arrived and disclosed that I live with HIV, they flagged me as high risk before I'd even seen the healthcare team. But even after healthcare had evaluated my condition, that label stayed. Gossip, an out-of-date file, and unchecked assumptions made it easy for 1 + 1 to equal 5. I felt alone, silenced, alienated. More threatened by the system than by any inmate. I filed a complaint, only to be told by a senior governor that the officers were within their rights to speak as they had. He warned me that pursuing my complaint further would result in the prison fighting back hard. Healthcare wasn't included in any of these conversations at all. Only one day before my release, my record was finally updated to reflect that I wasn't considered high risk, something I only learned through a Freedom of Information request. I did take legal action, but they settled out of court before the trial could even begin. Cowards. Yet the impact lingers. I no longer trust the system. The prison's misinformed label didn't just stay within its walls. It followed me. When social services got involved, they upheld that high-risk label, even though I am undetectable and pose no risk to others. They allowed me to see my children, but required supervised visits with my grandson. Social services won't budge. It's exhausting, and I'm tired. I face misinformation, ignorance, and stigma. But I will continue to challenge these injustices. I refuse to be bullied. I am no different to anyone else. I am not a danger to others. I am as important as anyone else. I matter too. Thank you for listening to my story.
Well, Wayne, thank you so much for that and for your frank and candid account of your experience. And thanks, Pank, too, for the presentation that you did beforehand. We've got about 40 minutes for this. I'm just going to, what we thought we would do is I'll talk a little bit, just very, very briefly, because I think people will probably want to talk to Wayne and Pank more than they might want to ask me questions. But I just wanted to contextualize just from my own experience around activism, perhaps, and research and scholarship in this area, because there has been a great deal about this. It might sort of provoke some thoughts or framing of questions that you might have. My immediate response to what you said, Wayne, and building on Pank's project, was the way in which research into human rights or scholarship into human rights or into health often, certainly from a clinical perspective, perhaps not from a sociological or a social perspective, assumes a kind of neutrality of these rights existing in the abstract conceptually. and that they are things which are recognised and honoured. And what you've shown very clearly is that the institutionalisation of people into, in this particular case, into prison, and it would be the case, I think, also for people who are displaced people through conflict or for economic reasons, find themselves in situations where, however clear the rights to something are articulated in the law on paper, they exist within institutional frameworks of power and vulnerability. And that it is incredibly important what you've done here, both of you, and particularly your voice, Wayne, in sharing a very particular experience in such detail, is to show how, in order to bring about change, people need to understand that it is not enough to have these things written down in books or in prison regulations or in legislation. It's about action, and it's about empathy and understanding and education and training. And we've seen this in a number of contexts with projects that have been undertaken nationally through the National AIDS Trust and through THT, the Terence Higgins Trust, in relation to policing and prosecutions and criminal prosecutions for HIV transmission, but more generally in the context of imprisonment and criminal justice, that those in power, those in positions of power, whether that is policymakers or in government, in the Home Office, in the prison department, or down through to governors of institutions or wing officers in prisons, it's there that people need to understand what the implications are and to share best practice and be advocates. And the obligation and responsibility that those of us who have the privilege to work in this area, from here I am in a nice office with books behind me and a voice which carries some authority in my own particular domain, to never rest by simply writing articles, but working with people who have been directly impacted and affected by this issue, and to recognise that there is a point where we need to stand back and provide space that supports people with the voice and with the experience to share their stories. There's only one other point I'll make before I open it up to everybody to sort of chip in, which is that we, and I don't know who's on this call, but people on this call will recognise that we often speak to ourselves and not to the people who we need to reach. And I think that's one of the biggest challenges, and one of the things we might want to think about in this webinar is I know, I speak from personal experience, that the moments where I've seen change happen in the attitude of people with authority, economic resource, and political power is where people have told their stories face to face, where they realise that this isn't just an abstract issue, but this is something affecting a real person in the real world. Some of you may know or have seen, give another example, and he's very open about this, I'm not sharing anything that isn't public, Robert Suttle, American guy who has been a very big activist in the context of HIV criminalisation. And one of the most powerful things I ever saw was in Oslo at a meeting of UNAIDS, where I can't remember who I think it was the previous director of UNAIDS was there. It wasn't a particularly happy story, but the previous director of UNAIDS at that time, Robert was in the room, and if I recall, he showed him his driving license, which said sex offender on it. He was an American guy from Louisiana in big red letters. And that was, if I remember, an immutable and permanent mark on the one piece of ID in the States that matters. Your ID is that license. And every time he shared his identity, that was marked on his driver's license. And when he told his story, he's an incredibly articulate guy in this room, you could see the emotional impact of realizing that what we do in this room, what we say, how we frame our arguments, who we talk to, when we talk to them, at what point in the policy cycle, is not just a piece of paperwork happening in a large room in the United Nations or in Geneva or in an office in Whitehall in the UK or wherever you may be from in the world in the government department, but is having a direct and immediate impact on the lived experience of a person who is flesh and blood, who is no different from you, other than that this is where they find themselves for whatever reason. And I think the powerful story you told, very emotionally, and I all respect Wayne on this, to have held it together. And I'm sure it's been very difficult for you in relation to contact with grandchildren, and that being something mediated by a government agency that simply doesn't understand, as far from the way that you've framed it, about undetectability and risk, and the way these things are characterized, is something that is a constant effort, and something that all of us working in academia, in research, you've got the opportunity to work in this area, must always be talking to you, must always be listening to you and people with your experience, in order to ensure that when we have a privileged access, if we do, that we are communicating and finding a space which enables that voice to be heard. I think that's what's really critical and come out of these very powerful presentations. So Nicoletta, I think probably that's enough from me at this point, because I think there'll be people who've got questions they have. Can we ask you to use the question function in the reactions to indicate whether you would like to ask a question? I think you can raise your hand, and we can see whether you are. And Nicoletta and I will share the chairing of this bit, perhaps, so that it's not just me droning on. But I can see that. So, hi, Sophie, nice to see you. I can see your hand up, so I'll hand straight over to you. Please feel free to ask your question.
Hey, Matthew, really lovely to see you. Thank you, EATG, for putting this on, and all of those that are taking part. I would just want to speak to Wayne, to be honest. Where's he gone? He's there. Wayne, an incredibly emotive sharing of your story. And so thank you. There are people on here that know me. I was diagnosed HIV positive in prison 22 years ago this month, actually. And I've worked with Matthew in the past, and I'm currently working with Pank with some work in the UK that we're doing. What really saddens me, and it to my heart, is that we're still hearing the same stories 22 years down the line, that people are still facing such horrific discrimination, such abhorrent experiences of stigma. I am left with permanent trauma from my time in prison. I really am. It's like the most, and I heard that with you. It is one of the most dehumanizing experiences that I think a person can experience, in the same as other closed settings. So I just really want to thank you for your courage, because it takes immense courage. I know it's needed, but it doesn't take away the courage that it takes to come and sit here and share with us your experience. And as somebody that I've worked with for a number of years in the sector always says, that we have to be visible to challenge that stigma. That also puts us in a very vulnerable position, because it doesn't mean that we don't stop experiencing it, and hopefully Pank can speak to some of the work that's being done in the UK, the research that we did, which really captured the voices of people living with HIV in prisons during the pandemic, but also the education and training, with such powerful results. And that's, Matthew alluded to that as well, in terms of, unless we get people informed with up-to-date information, unless we get that essential provision of peer support for people whilst they're in prison throughout their whole HIV journey, then we will continue to be really oppressed, because of how much stigma silences us and oppresses us as human beings. So thank you very much, Wayne, and to everyone else that's taking part today. Thank you.
Thank you very much, Sophie. Wayne, do you want to come back on that, or
I do. It's really difficult to impress on someone who's never experienced A, being incarcerated, and B, living with HIV. Particularly living with HIV and being incarcerated, how alone you feel, and you are reliant on what few prison staff, because they're not all bad, but there are bad eggs, as in any institution. Okay, you zone in on which staff are willing to help you, on those members of staff who show you some degree of humility and respect in order to continue to fight for your right to be heard and to be treated, rather to not be treated with disrespect. I think that's the thing. It was a really difficult time, and it's to hear actually speak with somebody that's experienced what I've experienced. It's reassuring for me that I'm still not alone. Thankfully, I'm not in that god-awful place anymore. But as I said in my story, it followed me. And to fight an institution, social services, and to not get anywhere, and to think, as you mentioned earlier, you know, we've come on a long way where it comes to treatment, but not attitudes. Some attitudes have changed, yes, and I think that's great. But I could not believe that in this day and age, an institution such as social services would continue that discrimination, that idea that irrespective of me being undetectable, there is always a risk of harm to others on the basis that my HIV status could change. So thank you for sharing what you shared with me. That's all I wanted to say.
You make a really important point there, I think, Wayne, about how one of the challenges is identifying each of these particular moments in somebody's life journey, and in prison being one of yours, that actually needing to understand that these institutions operate within a broader and more complex network of relationships that follow you afterwards and embed you, so that when Sophie was talking about the sort of psychodynamic, or the psychological trauma that is sustained after an experience of imprisonment, being amplified and reinforced through, as it were, experiences of discipline through what you might think of as being a socially supportive network through social services, or something which should be geared towards support and reintegration, but reinforcing, as it were, or mirroring or repeating or reinforcing the experience of having been damaged or harmed through the experience. When you teach criminology or criminal justice to students, I can't remember where the quotation comes from, but it was always the liberal model that imprisonment was as punishment, but not for punishment.
Precisely.
That was the point, you know, that if you have a state which says that imprisonment is the response, and I'm not arguing about the merits or demerits at the moment, but once you're there, it's the fact of the deprivation of liberty, which is the only thing which should distinguish you from anybody outside. But then to have a imprisonment being something which makes things worse for someone beyond that deprivation of liberty is an indefensible. Is indefensible.
It is.
Yeah.
But I just want to add that when the discrimination started with the accusation that I was infecting other prisoners intentionally, I hadn't even engaged with anyone in that manner. It was a heterosexual individual, that HIV negative, that said to me, "That's wrong. That is wrong." And it was only after I thought about what he said that it occurred to me that it was wrong and that I should do something about it, because if I didn't, it would have made my time in there even worse.
Thank you. Pank, I don't know whether you want to add anything to that, or whether we have anybody else who'd like to come in with a question or an observation.
Yeah, I think what I'd like to sort of add there is that you know, kind of what Wayne mentions is really quite pertinent. That, you know, we know that these instances when they happen to us are wrong, but to then voice that is met with such aggression in so many ways that it you know, a lot of the time it puts people off, or they feel that they're not strong enough to actually deal with it, or they feel alone and don't have the support to deal with it. And the danger of this is that it can lead to someone taking their life. And I saw that, you know, kind of with my time in prison with, you know, a young lad that had served 3 years and was bullied because of his status, and didn't feel like he had that support. And so 7 days before he was meant for release, killed himself. 7 days. He couldn't wait 7 more days. You know, I mean, and imagine feeling that alone, you know, sort of whereby you cannot wait 7 more days before, you know, before you never had to see any of these individuals again, before you could put all of that behind you. But in that moment, that was something that he just couldn't fathom. And to see a body being wheeled out on a gurney and knowing that this was as a result of this continued stigma, the continued misinformation, miseducation, and the discrimination that people living with HIV face, was something that, for me, you know, sort of, and as for Sophie or for Wayne or for anyone else that has actually experienced it, was something that we're just not prepared to actually put up with anymore. You know, that is the danger when it isn't taken seriously, when that support isn't there. It can lead to the loss of life, you know, sort of in a way that we wouldn't want anyone to actually sort of, you know, kind of a route that, you know, going down. And unless we all actually take that responsibility and stand up and say, hold up, we have allowed these closed systems to go unchecked for so long now, and we've all allowed that, you know, and if we don't stand up and say, right, no, we need to do something about this now, we have to actually take responsibility and say, no, there has to be transparency. You have to ensure equality for, you know, whether it's healthcare access or anything else. Then we are all culpable. We are all part of the problem, you know, sort of, and I, for one, and I'm sure everyone in this room doesn't want to be part of the problem. We'd rather be part of the solution. And that begins with actually having that difficult conversation and pushing back and saying, enough, you know, sort of 40 years is enough. The fact that we're still talking about stigma now, 40 years later, shows us just how little we have achieved when it comes to public attitudes. And I think that's what we need to focus on, because if we don't get rid of that, we can't make the change that we want. Well
said, Pank. I'm going to have to call you Galaxy S20 FE because I'm afraid I don't know your name. So perhaps you could introduce yourself if you'd like to.
So sorry.
You don't.
My name's Anita Binns. I'm a volunteer with Positive Speaker at George House Trust in Manchester. So Gary forwards his massive apologies. He had an appointment that he couldn't not come to go to, but we'd both joined to come on this. I was very lucky 3 years ago, Wayne, to be invited as a positive speaker to an open prison up here in Lancashire, and I'm with you guys so much that unless we change the education and we change what picture people have in their minds of what HIV looks like, then that's the only way. Because it amazed me. We went to an open health day at the prison, and I didn't say my status at first. I had been living with HIV 38 years. But when I did openly say that I was positive, all the guys, because it was a man's prison, literally were shocked because they didn't imagine that HIV looked so well. So they were more open to the conversation and to learning that, you know, it affects everybody. HIV doesn't care what you look like. And it broke a lot of stigma. And I do believe that in everything in what you said, when you just said it then. Without the education, Pank, we're never going to move forward unless we have people going in that's going to turn their minds around. But thank you very much for speaking, Wayne. That was really emotional.
Thank you.
Thank you.
Thank you, Anita, and give our fondest regards to the wonderful people of George House Trust as well. Been up for a long time, but it's nice to hear from you. Wayne, again, would you like to come back on that, or Pank?
All I would say is that she's absolutely right. People imagine that HIV is something that affects only men and gay men, when actually I think that well, it affects anybody, as the lady said, and I think the guys looked so shocked because she looked so well. She said that it just was not something that they ever expected or were expecting of that day. But so thank you. I just wanted to say thank you.
Thanks.
Yeah, and I think I'd like to sort of add to that in terms of, as Sophie had mentioned before, the work that we are doing in prisons now, the education and the awareness sessions that we're delivering, the advocacy and the support that we're showing towards those that are living with HIV, as part of a partnership, you know, with the Sophia Trust, the Sophia Forum, with the National AIDS Trust, with the Terence Higgins Trust, and with the CI Square Bureau. You know, sort of we are making that difference, and we are seeing that, and it's very, very clear that is the way forward. And it's really, it is heartening when we see how those attitudes change. I never thought in a million years, I never thought I would hear a prisoner say, "Get me a T-shirt that says, 'Ask me about HIV,' and I'll wear it." I never thought I'd hear that. Or have somebody interrupt our story and say, "Can I change my answers on the survey that we've just done because I'm embarrassed by what I've just written?" And you know, and it just shows the transformative effect that you know these programs that we're delivering do have. But we can't do that unless it's funded, and herein lies part of the problem when sexual health in general, especially when it comes to HIV education in prisons in particular, isn't seen as important enough to fund, then how are we supposed to change it? You know, sort of, and that's where I think we need to obviously sort of look as well, is that we need to make sure that people understand that this is something that is so important that it has to be funded. And without that, we can't get to where we want to be and to see those transformative changes that we want.
Absolutely, Pank. And before I just come to Sophie, I mean, at the moment, what's happening across the Atlantic with USAID and PEPFAR and everything, that the importance of local initiatives being driven as far as possible within existing budgets and in those countries and states which remain committed has never been more important to keep that momentum going. I was just reminded when you were talking about something that shocked me and won't have shocked you, but when those of you who've read, as I'm sure you have, the kind of earlier work on stigma, so I'm talking about 1990s now, going back into the late 80s, 90s, and right up into the 2000s, which is what was sad. It's the point that was being made about things carrying on into the present, is that some of the worst discrimination that people living with HIV experienced was from healthcare workers not working in the field of HIV, dentists or general GPs or these were the spaces, tragically, where people experienced the worst discrimination, where the stigma was greatest, being refused treatment in dentists, being and misunderstandings or a lack of understanding. Any of you who've ever spoken, I went to talk about HIV at a conference of hepatologists once. It was the most terrifying thing I've ever been to, because I'd been working with HIV doctors and clinicians who were, on the whole, very clued up. They did understand the issues when they were specialists. They'd gone into it because it mattered to them and understanding that. The people who were more complicated were people working in general healthcare and in prisons. That's a particularly challenging area. Sophie, do you want to come back on this? Thank you. It's another point possibly.
So I wanted to take a step back around the criminalisation, because Wayne mentioned about women and the kind of whole assumptions that can happen around women not being affected by HIV. I know they weren't your exact words, but that's how I'm contexting it. And so you and I are very aware of the Sarah Porter case. And what I wanted to ask you was, if possible, you can give that kind of because if that went to court today, Sarah would not have ended up in prison. And so I was wondering if you could share some context in terms of how the process of actually coming to criminalize someone around HIV has changed from the early 2000s to the current day. And some of your experiences in terms of, because you were so heavily involved. I mean, you wrote a book around it, so it'd be really lovely to hear if possible.
Thanks. I mean, I think the biggest issue, I have to say, so yeah, you're absolutely right. I think the criminalisation in terms of those people clearly going to court and being convicted and going to prison has massively dropped off, certainly in the United Kingdom, in England and Wales. But and that is because of treatment, is that it's impossible to establish. People who are on effective treatment, able to access treatment, are undetectable and unable to transmit. And that is something which is going to make it very clear that when you have a criminal justice system or a criminal law which is geared around harm through transmission rather than exposure to risk, is going to limit the number of people who end up getting through to that point of trial. But what we do know is that it absolutely hasn't stopped investigations. And the investigative phase, through police officers being insufficiently aware of what being undetectable means, what the effect of antiretroviral treatment is on infectivity, means that the first stage of people, this is what I understand from research being done by NAT currently. Pank and I were at an event, a Beaver event a while back, where this was being presented, is still an issue, that police officers are insufficiently exposed to these cases. They're rare. They immediately take a precautionary approach. It has a parallel, I think, with what Wayne said about social services. They feel that their responsibility is to potential victims, to the person who may have made the complaint, to them, and that means taking away, mobile phones, any evidence that might suggest that somebody's been involved in, websites or dating websites or sex meet websites or whatever they might be, and any evidence. And that disruption reinforces that stigma and absolutely amplifies it. But then that doesn't get reported because those things end before they become a news story, because suddenly somebody says, well, actually, you're never going to be able to take this any further. Crown Prosecution Service guidelines and guidance won't allow it to go any further. But by the time that's happened, the horror to the person's life has already been incurred. And, we do have horror stories of people. All you would need to do is to go, I suspect, into a police station and say, I've discovered that so-and-so, who I've had a sexual relationship, is HIV positive, and they didn't tell me. Right? Or that gets through a gossip network or something, and that instigates an investigation. Even if it stops, the harm is done at that point for people. So I think you're right in saying that there has been a diminution in the number of convictions, and that's only as to be expected. But in terms of the disruption of people's lives, and I want to stop because we're coming towards the end, and I want to make sure Wayne and Paul haven't. Oh, sorry, Paul. I saw your name was next to Pank, so I was saying Paul and Pank. Hi, Paul. Let's see. To speak, is that we still need to keep up this work. I think there is a real danger over the last 20 years that the improvements in treatment, the welcome improvements in treatment, have meant that there has been less of an eye on the ball of the incidental and continuing impact of stigma in people, for people living with HIV. Imprisonment remains a challenge, closed settings remain a challenge, investigations remain a challenge, discrimination in healthcare settings remains a challenge. All of those things need to be reinforced that there's still an issue. But it's harder to do that. And as you know, as Pank said, the funding is really challenging. How do you keep that pressure up? And that's something where I think partnership with universities, with scholars, researchers doing research into this area where there is access to funding through research councils, if not through health authorities, is something which should continue to be an important priority. But I'm going to hand over, if you don't mind. Nicoletta, will you take over the last 5 minutes? Maybe
Yes.
with Wayne and Pank, I want to hand over to you.
Before I led to Wayne and Pank for the last few minutes, I want to say a big personal thank you, because sharing lived experiences, sharing personal stories requires courage and integrity is important. The power of lived experience is something that we should, and I'm speaking as EATG now, I think it's important that we value much more the power that lived experience has. I also want to say something that picking up from conversation, because I don't want this to be a conversation which is very much UK focused, because I think I want to make the point that improvement in treatment hasn't necessarily meant everywhere in Europe that people had experienced less harassment from the police, that haven't been incarcerated less. I mean, there are still in Europe, in many EU member state countries, legislations which are criminalizing people because of they use drugs, for instance. So we need to take into consideration that within the wider European landscape, there is so much that we still need to do, whereas the UK always feels that is slightly far ahead compared to other countries. And in order to be able to talk about, prison health is a public health issue, has to be this for everyone. So those who are living with HIV in prison must be treated equally to those who are not living with HIV in prison, for all the reasons that we have been listening earlier. But also we need to take into consideration, again, I'm repeating before I leave the floor to those who have shared personal stories, but lived experience has the power to be the change maker that we need. And, taking from Pank, we need to be part of the solution, but the question to both Wayne and Pank, how can we be part of the solution, which is the real solution?
I'll go first there. I think if we're people living with HIV make up such a fraction of the percentage of the global population, yet the way that they are treated is so hugely impactful on a global scale. And we see that, we've whether we hear the stories, whether we've actually read about them, we see that impact that is there. If we're going to be part of the solution, I do believe that it has to begin with activism. We can't, it's great that we have these seats at the table. It's great that we can have these conversations diplomatically, but ultimately activism has to play a part. And we can't take our foot off that gas pedal when it comes to that. It has to be a fight. In the same way that we fight for so many other injustices, this is no different. It is an injustice. And for that, we have to fight. And so it's about galvanizing, sort of an army that is not prepared to accept the status quo anymore, that isn't prepared to follow what it is that we're told or expected to be, and to have to live with the inequities that we see when it comes to people living with HIV, especially within criminal justice and prison settings. And so I think the solution is about making sure that we all stand up, that we use our voice as much as we can, that we ensure that those that are living with HIV are supported, that they know they're supported, that they feel empowered to then themselves go forward and say, this has to change. And I think if we can do that, then that army that we build is so much stronger and becomes so much more impenetrable that there is no choice but to change. And that's really what we want to do, is give them no choice but to change. But we can't do that unless we're all on the same page, first of all, and we build that impenetrable barrier that they're unable to actually get through.
Thank you very much. Wayne?
Yes, all I would say is that I just think that irrespective of the routes of transmission, this is not, the route of transmission is almost irrelevant. It's not about that so much. It's about how people living with HIV, irrespective of how it's been transmitted, are seen. And I think, you know, we have the tools, we have the evidence to support what we're saying, but it's so crucial that we remain visible in order to be heard. And that means continuing, you know, webinars like this, going out into the community, into the criminal justice system, not just in the UK, but throughout Europe, because we all live on the same planet, okay? So HIV affects the world. So I just think it's so important to keep talking, keep reminding people, and being visible. That's important, because the moment we're silenced because of either lack of funding or ignorance, that's when that's when those old, entrenched, outdated views will resurface and start to germinate.
Thank you. I want you to close this webinar really with your words, Wayne, because this is very powerful and very important. And it's almost, thank you, Pank, as well. This is a call to action that won't go unheard. And I think this is the beginning of something that I'm not really sure what is going to be next, but it will be, this is not the end of a conversation about HIV in prison, and surely it's not the end about stigma and discrimination. So thank you very much for taking the time to share your experience with us. It's been a very powerful time. I've learned a lot. It's very difficult to then summarize your powerful words and put this to an end. But as I said, this is a call to action. This is the beginning. We're moving somewhere else from here to whatever we need to do next. I think because otherwise my colleague will kill me, there is an opportunity for you to give some feedback at the end of the event. I'm really, really pleased that many of you turned up. As I said at the beginning, this has been recorded, so there will be opportunities for others who couldn't join us to learn. And I hope that there will be other opportunities for meeting each other, maybe in person, and talk more about what we can do as a movement, as activists in Europe. Thank you very much.